Hello, everyone. Thank you for joining forpay.org, a non-profit service-based company. Works for all of you. Okay? It works for all of you. This is Consumers Doctor, Dr. Bengala, a volunteer for the nonprofits. My goal is to educate, bring up the topics, and make people aware and let people decide what this is healthcare is all about. Okay? Again, we are spending $3.8 trillion in healthcare every year, and we rank 39th among the most advanced countries. And $3.8 trillion is a lot of money, folks. If you give the control back to the people, that can be brought down by 50 to 60%, folks. Like anything else, competition, transparency, affordability will bring down the cost of the healthcare, man. I don't know why people can't get it. And people have self-interest, like insurers, providers, everybody have self-interest to keeping it status quo. It's no longer going to be. It's going to be consumers who will be driving down the cost of the healthcare. I really believe in that. Only consumers have the power to bring down the cost of the healthcare. I want you to give guys a serious thought, seriously you need to look into it, how we can bring back the power back to the people in healthcare. By doing that, you will drive down the cost because consumers demand affordability, demand transparency, demand and they pay as you go. And you can do that by having deductible policy. Depends on each individual person. Traditional insurance numbers are numbered. I don't think anybody should buy traditional health insurance anymore. They should buy a deductible, low premium, high premium, depending on what they can afford. If you have a low premium, you have a high deductible. If the people want to buy high deductible, they should have every right to do so, like any other home policy, car insurance policy. And a high premium with a low deductible, they can buy high premium with a lower deductible. Yes, I think we should do that. Everybody, even people on Medicare, Medicaid, veterans, they should have health savings card, like a veterans card, Medicaid card, Medicare card. They should have a savings card to pay as they get the care. These 9,000 billing companies, folks, and mid-level management companies, they need to go, man. They need to go. We are wasting our money in the mid-level agencies. The insurers have to realize that can't go on. These mid-level agencies, managed care organizations, and medical groups, they're driving away the competition. We want more competition, not less competition. We want less consolidation. We want openness in healthcare, like we have any other industry. Look at Amazon, look at Google. We have to compete. Everybody has to compete. As a healthcare provider, I have competed for the last 30 years as a solo practitioner. I've never been. Again, once they start forming these medical groups, it's healthcare industry has changed a lot. These medical groups is basically has not driven the cost down. They have increased the costs. It's a totally opposite of what it was supposed to have been meant. These medical groups have increased the cost, not lowered the cost, and hospital charges are made up, man. These CPT codes, DRG codes, they're all made up. They're not true numbers, folks. We need to get rid of the CPT, DRG, you name it. And this American Medical Association has to wake up and support the Americans rather than supporting, I know they're trying to play the best interests of the healthcare professionals, but they need to wake up. And Health and Human Services have to wake up. Health and Human Services are putting your dollars. I have Medicare. I love my Medicare, but I don't want to give up on my Medicare insurance policy to so-called this Medicare Advantage. It is a misnomer, folks. Don't give up on your Medicare insurance. If you can do it, don't give up on your Medicare insurance, because they may offer you all the freebies, but it's not worth it, folks. If you can afford it, supplemental is the way to go. And if you can afford it, I think Health and Human Services give an opportunity to everybody to have a health savings, even for Medicare. They should invest in you. They should give you that $1,200, which they give it to the mid-level companies, mid-level insurers. Give it to you. You can have that $1,200, and you can buy your own deductible insurance and put money aside and save it into your Medicare savings. I think we Medicare recipients need Medicare savings card. I will go to this extent, guys. Even Medicaid, unemployed, they have no jobs. They're giving Medicaid benefits, but when they give Medicaid card for insurance, health care, that's not working. That's not working. So we need to give the back that Medicaid funds, what the government is spending, have them give you an option to buy your own private insurance. Even I'm talking about for Medicaid, they should be able to buy private insurance, and whatever the money they're investing on Medicaid, and you can save a portion of that money and put it aside into your own Medicaid savings account, folks. You'll love this idea. I should thank Ron Bachman, an actuarial. He has written a book. I want everybody to read it. Unlocking the Secrets of Healthcare, Health Insurance Premium. Unlocking the Secret. He's the one who introduced Medicare supplemental, folks. Great guy. I have spoken to him a few times. I love him. I love you all. If you like what I'm saying, I'll continue to talk about these things. We need more openness in healthcare. We need more transparency in healthcare. We need more affordability in healthcare. Let's all do it, folks. If you do like this channel, do subscribe, hit the like button, and share. I'll love you if you can do that. A small favor for me. I think it goes a long way, folks. I'll continue to do this till the day I die. Yes. That's the way to go, man. That's the way. I don't know how long I'll be, maybe another 15 years. It doesn't matter. My kids are well settled. They're healthcare professionals. I think I want the healthcare to go in the right direction. That's all I care about. I don't give a damn about anybody. Insurers, this California Medical Board is a joke. They're not doing any favor. I should thank them for letting me go. Yes, I should thank them for letting me go, because I'm totally liberated. You know what? They did me a favor. They took away my California license. Do I care? I'm better off now than under this stupid managed care. I'm glad they did that to me. Thank you, guys. I love you. I love you all. Please do share, subscribe, and you'll be seeing me more often than what you think. So follow me. See you in the next episode. Goodbye.